Hi, folks. It's Thinking Slow here. We're going to do a quick episode now about the latest data on vaccines from the UK, which is up to May 2022, and also some figures about weekly deaths in July 2022. And the point of doing that is not to nitpick lots of little numbers, but it's actually just to give you an overview of where things are at, and more importantly, probably to talk about the methodology, because I think what we've tried to do is show the way numbers are twisted, and we're showing the methodology of how things are being controlled, which is falsified and exaggerated models, the creation of fear, the use of that fear to manipulate people, and that manipulation involves government grabbing power and transferring a lot of money to vested interests. So, the point of today is to look again at the methodology, and we wanted to say a few words about climate alarmism, because that plays into exactly that methodology. So before getting into that, we'd just like to point out again this Patreon page. We really appreciate any support we could get on this. We did actually miss quite a way our targets for July. And then hopefully we can catch up a bit in August. So if you enjoy the work we do, you find it useful, and we have had people have said it's been useful, please put this on pause and take a couple of minutes out to sign up. The other thing is, I think for August we've got a pretty exciting program coming up, and one thing I wanted to talk about is a guy called Dr. Joseph Boot. We'll be doing an interview with, and he wrote an absolutely fantastic book about what happens when you get rid of basically Christian ethics and create the vacuum that we're kind of in now. I think you'll find that very, very interesting, because that is the way out of the rabbit hole. He actually explains what's going on in terms of ethics and culture, and how that plays into the kind of dystopian stuff that we're seeing at the moment. Fascinating book, and a very interesting guy. Okay, so on with the statistics and a few words about climate change. So just starting quickly, this is the latest weekly deaths in England and Wales. I just wanted to really make a couple of small points here. So, here is the wave in blue of COVID hitting. This is the second hard wave across winter 2020, 2021, which is kind of what you'd expect for a seasonal coronavirus. And then here you're implementing this sort of mass vaccination from early 2021. We can look a little bit about what might have happened in winter 21. But generally speaking, you would expect a pandemic of a virus to sort of the waves would go down in peaks. So this could be anything here, but this much smaller peak than here could well be just the pandemic wave playing out. But the real point I wanted to make just here and now actually is a surprising one for me, which is the July 2022 total death figures in England are very much higher than they were in 2020. And, as in all of these things, there's all sorts of different factors involved, the so-called confounding factors, and heat will certainly be one of them. It's been very hot in England, but this is a very surprising figure, and we'll just peel it back a little bit. And the reason we'll peel it back is so you don't get confused by any government statements where they only talk about the COVID deaths, which is these small blue bars, and they don't mention the other non-COVID deaths. And that's been one of the things we've spoken about quite a lot, is all-cause mortality is really the gold standard at the end of the day. So just, here is peeling back the split of those bars. So what you actually saw in those into that July 2022 is you did actually see a drop in COVID deaths compared to 2020, but you see this, quite frankly, bizarre, enormous increase in non-COVID deaths. So net, you have this increase. So, if the government talks about this, they will talk about this fantastic reduction in COVID deaths compared to, 2020. but actually that's more than offset by an increase in non-COVID deaths. So net, you end up with more deaths. And just flicking back, you can see that here, these red circles are on the same level. So you can see there's nothing here, and then this is full on this side, and this is the same level on the y-axis. So this is higher overall deaths. So again, a reduction in COVID deaths, but then a very big increase in these green non-COVID deaths. And when you look at their claims, you always have to be wary of what they're actually talking about, because they will show you the piece that supports the narrative and not the rest of it. And so all-cause mortality is the one to look at. Now, let's talk about quickly the reasons for that. I've mentioned heat already, but I just wanted to put this chart up. We looked probably quite a while ago now at levels of hospital waiting lists in the UK. This is actually England, and we haven't looked at it for a while, but I was completely amazed to see that it's still nearly 1/3 people in England waiting for NHS treatment for more than a year. I mean, that's such a big number. I got to sort of say it again, 1/3 for more than a year. And this is where this process started, and this is where they started emptying out the hospitals. The modelling started, the COVID panic started, and frankly, the overreaction started. Effectively, the NHS is effectively broken, and looking at this line, there's no sign of that recovering anytime soon. And this is the long-term damage that Professor Sikora and many others spoke about over and over again, basically, that this is what you're going to end up doing through lockdowns and panics and everything else. And this is still here. I'm surprised it hasn't gone down at all, really. I mean, okay, it's gone down from the highest point ever, but it's still kind of flatlining now. And it's impossible to imagine that 1/3 people can be waiting for treatment without having some knock-on effect onto excess deaths. So, that's just there. And we'll come back to the political part about this, because, at the same time, the politicians are blaming people for not showing up for doctor's appointments and looking for ways to find them, whilst at the same time not providing 1/3 citizens with healthcare that they've paid all their lives for. Typical politicians. So anyway, moving on, let's look at vaccine effectiveness. This is it's probably a little bit hard to see, but I drew a theoretical line of what a zero effective vaccine would look like against mortality. And basically, here's the y-axis, could be monthly deaths, and this would be the x-axis time. And the thing I wanted to point out here is that these curves, for the vaccinated, which would be this dotted line, by definition, you're starting out at 0. So, at the beginning of a vaccination program, you won't have any vaccinated and no vaccinated deaths. So this point will always start at 0, and we described that in a couple of other videos. Whereas all of your deaths will be in the unvaccinated, which is the solid line. So you'll always start with this huge sort of discrepancy between 0 and whatever number this happens to be. Now, the other point we'll look at here as well is age standardization, which we've spoken about before. But because the very elderly are getting vaccinated first, age standardization really almost weights those deaths down to 0. So that will tend to keep this number very, very low on an age standardized basis. And I'll show you an illustration of what that looks like and what I mean. But then if you have 0 effectiveness, you will basically move up to the same monthly death figures on an age standardized basis as you have for the unvaccinated. So the two lines will move together. That is what 0 effectiveness implies. And I would also have a hypothesis that the curve will basically go down. So the peak of monthly deaths will be lower on each successive wave. So this is already the second wave when you're having this very hard winter 2021. So winter 2022 would be the third wave, which you'd expect to be sort of lower. And as a counterfactual, there's several charts with 2 bumps, 1 bump, 3 bumps, but this is what happens, and there's many pandemics like this. So it would be reasonable to assume, this one herd immunity achieved, and then it goes down. So it's reasonable to assume this would go down. So bear that in mind when we look at these charts now of age standardized mortality, that the starting point will always be very high for vaccinated and zero by definition for unvaccinated. There'll be this sort of thing, and then when there's no effectiveness, they will be moving exactly together, the two lines, vaccinated and unvaccinated. So what do we get then? I'm starting now with a table. There's been quite a lot of talk about this table already, and I'm going to just sort of quickly go through it. This is the May 2022 COVID deaths by vaccination status, and there's lots of different vaccination statuses, but I've just added them up. Actually, ONS have added them up now as well, and that gives you 82 deaths involving COVID in May 2022 for the unvaccinated, 1,282 for the vaccinated, total 1,364. And you have that means 6% of your deaths are in the unvaccinated, and 94% deaths involving COVID were in the vaccinated. Now, as a sense check, you can just basically compare that across to what your proportion is of vaccinated versus unvaccinated. And we've had debates before about there's all kinds of different conventions around this, but looking straight at the government dashboard, I mean, essentially you could say the figures are identical. And that has an implication for vaccine effectiveness that I can't say explicitly on this channel. But if, as claimed, the vaccine is somewhere about 90% effective, you would expect to see about a 50-50 split in deaths, because these would be 9 times higher than these per person. So you'd end up at an equal number of deaths across the two groups, but actually you don't see that. You see only 6% in the unvaccinated. So without saying the quiet part out loud, I hope you can get a feel for what that means for vaccine effectiveness against mortality, and we'll look at the charts now. So this is what I was saying is the issue of age standardization. So it can be very useful when you're trying to standardize from, you know, a group of people who have an average age of 60 to a group that has an average age of 40, and comparing the 40 to the 60 to the 40. That there it works, but you know the problem with the COVID age standardization is that the deaths are heavily concentrated in the sort of over 80s, so average age of death around 82. So when you start age standardizing that, because it's so unrepresentative, you end up reducing this figure almost to zero because of the weighting factors. And this you're looking at raw deaths. This is not age standardized in the solid line. This is just, I think this is just, okay, this is the number per 100,000 person years. And then this is what happens when you use the age standardization. You're effectively having this very high number weighted down to almost nothing. And that's just a magic of maths. It's not really reflective of reality, because you're applying a methodology to a very, very unrepresentative age group of average 82, and I don't think the methodology is designed for that, and it does create this misleading, I would say, result basically, and which we'll look at on the next page. And we've done a big video about this, so there's no point in going through it all again, but it was there, the Goodbye ONS Integrity video. So let's then basically look at, on a crude basis, what you have. So this is before the age standardization. If you take, this is the all-cause mortality per 100,000 person years for vaccinated orange versus unvaccinated. So vaccinated is very, very much higher. And of course, that is mainly due to the fact that this is a very elderly age group at the beginning of the vaccination program. And then this will go down over time as the age profile of the vaccinated gets younger and younger. But still, on a crude basis, you have this enormous difference between the vaccinated and the unvaccinated, which is much, much lower. So now you put the two factors together. I'm gonna skip this one. You put the two factors together to get age standardization. This is for COVID only. And, again, bearing in mind what I said, that the starting point for the vaccinated will always, by definition, be zero at the beginning of a vaccination program. So you're not a million miles away from that curve I drew, the theoretical illustration. But yes, there is effectiveness against COVID only, but that's already waning pretty significantly down here. And then if you put that on the same scale, if you make that all-cause mortality to avoid the issue of age, avoid the issue of death attribution, this is the curve you get, and you basically can see here that the age standardized mortality rates for vaccinated and unvaccinated are identical for this last data set in May 2022. So on all-cause mortality, there's no advantage vaccination versus unvaccination, although there's a few percentage points here if you're looking at COVID only, but on all-cause basis, it's nothing. Let us skip this one. And this is something we did, you remember, a couple of weeks ago. This is the breakdown by age group for March 2022. I didn't update it for May 2022 because it's the same essentially. So the sort of net zero effect is not evenly split across age groups. So these very low mortality rates for the younger age groups, they're slightly higher for the vaccinated versus the unvaccinated, whereas for these age groups, the mortality rate is lower for the vaccinated, the grey one, than the unvaccinated green. But net, there's not much in it really, but there is a slight difference in the impact across the age groups. So the mortality rate is higher for the vaccinated in these two categories, but these two categories in absolute terms are very, very low, and I've put a log scale on here. So that was really, I think, what I wanted to say about the actual data for effectiveness. Now, I wanted to say a few words, as many as I can on YouTube, about this 20 million lives saved figure. And we've also done a video on this before. People have been following the channel. Were 105,000 lives actually saved? And I think it's on another video, and I'll show you one slide from that. But in 2 seconds, basically, this is the methodology that's used for that. You take the assumption about effectiveness, you take actual data, then you construct this counterfactual, which I've called BS for obvious reasons, which is the actual data over 1 minus the assumption on effectiveness. And that's what they've done. And I'll show you the illustration, but that's how the lives saved number is calculated. So it's all based on an assumption of effectiveness. And going back to those tables where you could see the effectiveness of these mortality rate of vaccinated and unvaccinated meeting, that means at that point the effectiveness is zero. So that means this assumption that they've used throughout the whole process of somewhere about 90% just isn't valid. And it's really it's totally circular calculation. You sort of take the assumption, calculate the counterfactual, and say, hey, look how well it's working. Well, you've assumed it's working that well in your assumptions, so you're proving nothing. You're just going around in circles. And we did a big illustration of that last year, but this is a picture of what it looks like. You take the actual mortality that came about, then you basically, in this case, I think you multiply it by about 25 or so based on an assumed effectiveness, and you draw this line. And I drew this line back then showing it's completely sort of crazy to imagine this was for summer 2020, that this would go to this level. You can see this doesn't make any sense. This is not a valid methodology for working out a counterfactual. You'd have to really have a much better idea of where this pandemic was going. You can't just divide this number by 1 minus assumed effectiveness and end up with that. It doesn't make any sense. But again, it's the methodology. I wanted to show that when they throw numbers like that out there, just be wary of where they come from and how they're calculated, and really how realistic they are. I've got a view on that I'm not going to say here. So, again, that was the quick run through of the figures. So July 2022, all-cause mortality is higher than it was in 2020. That's worrying. Needs explanation. Heat's probably something to do with it. The lack of healthcare is something else to do with it, but there's some other questions, and this is a problem. This is a problem but it's not the impression you get from the bombardment from mainstream media, where you get these numbers like 20 million saved, safe and effective. The actual data is not showing that. But again, the point of looking at this, though, is to talk about the methodology and to talk about the much bigger picture of how we're being manipulated into destructive policy choices. And we did this in the film on climate change and the cost of 1.4 trillion for net zero. This is one slide taken directly from there, but this was what set this whole climate alarmism off. Really, was a model from the mid 1970s where the Club of Rome elite basically decided that if people were left to themselves, the world would turn into a petri dish experiment where the population would have an uncontrolled collapse at some point after sort of running up too high. But if they managed it, you'd get these blue boxes where everything's perfectly managed. Of course, they volunteered themselves to be the overlords of everything in the world. Would all be done by them in the Club of Rome, people who we never elected. We don't know who most of them are. But this is a self-appointment on their part to be the sort of global government, effectively. And if we didn't do that, the world would collapse. So we have to do it. And this was all based on, their conclusions were all based on black box modeling, no visibility into any of that. Basically, the creation of fear through exaggeration, and then that fear and that exaggeration leading to extremely damaging policies because they're completely disproportionate to the actual threat being faced. So, that sounds like COVID, that sounds like climate. It's the same methodology. That's why we wanted to look at the numbers today, just to bring that out one more time, because we now need to move on to climate and start looking at that, because the problems and approaches are the same. This is a brilliant thing that came out today. Really, I almost in a way fell off my chair. I know this is the way they're thinking, but it's only now and again that you see glimpses of this. Hey, basically the message is, hey guys, war with China, why not? Because that'll be good for the planet when you destroy the economy. This is literally the way these guys think. They are obsessed with this, and they are alarmists, which means for them, any economic damage they cause is actually good because they're avoiding the catastrophe of a climate collapse. This is a death cult, really, when you think about it. So when you see it in black and white like this, and people ask me, is this a hoax article? No, it's a real article, and it basically it expresses what's quite often unexpressed by these guys. And you can see this in their things they call a degrowth strategy that sounds really great, but actually it means wiping out your economic prosperity. And this is where these guys are at. This is as I said, a death cult. So and the way it works is the same as the way the COVID works. It's opaque models, fear, manipulation through fear, and then massive overreach, and then huge transfers of money to vested interests, and almost always the vested interests are behind the modeling and the policy response. So this is the name of the game, basically. And just to put that into a little bit of a picture, this is the vision you're sold. It's all going to be great. We're all going to be friends. There's going to be no national wars because there are going to be no nations, and we're all going to live happily ever after. But really, what's really going on is this is really an oligarchy. It's these closed shop clubs, the Club of Rome, the Trilateral Commission, World Economic Forum. They decide policies. They make bets based on those policies. So they front run a policy. Then they fund think tanks. Those think tanks heavily influence government policy. They get their way. They make money. Everyone's happy apart from you and me. And really, this is the way it works. I mean, we've spent quite a long time piecing this together, and we'll do a little bit more work on this. But it's quite naive to expect this is going to be a reality. And we can look at that in more detail in another film. But I think that really is the whole direction of travel at the moment. And we talk to the small parties quite a lot, because this is what the people have to really conclude, that the main parties are really captured by these think tanks, and those people, they're in a sense gone. I don't care if it's Truss or Sunak or Johnson or Tugendhat or any of those guys. They're essentially captured by this, by essentially the World Economic Forum that's setting policies for everyone, including for us. So the only way you're really going to get a proper consideration of what people actually want is to vote for the parties that are close to the people, and that is the startup parties. And that's really a long haul battle. I don't know if it's ever going to come to fruition, but it really is the only way. The other way is death by 1,000 cuts, as we have more and more policies and social engineering imposed on us on a top-down basis. That is death by 1,000 cuts. We're seeing now living standards collapsing, and I use the word collapsing not to be fear-mongering. It's true. Real wages going down now 4%. That's very, very high. It doesn't sound high, but it's very high. And that was only to May. I think by now will be about 6%, which is really essentially off the scales for the last 150 years. Real wages don't go down like that, but they are now. And that will continue until such times as people's well-being is the driving factor of this. So you can have a balanced approach where you don't destroy people's well-being on behalf of the planet, but you obviously don't destroy the planet in order to generate well-being. You get somewhere in the middle, which is sort of where we were until these zealots took over with the death cult, which is where we are now. So until really people mobilize and get behind these new parties, I think that's going to be the name of the game. And people's willingness to be constantly ripped off by the same politicians, I find amazing. And we'll do a video on this Liz Truss coming out saying she's against lockdown, having voted for it over and over again, and people believe her. And to me, it's mind-boggling. Why would you believe someone that's saying they're against the lockdown when they just spent years implementing it and voting for it? Completely in crazy, in my view. But anyway, there it is. So that was really it for today. We do have some interesting stuff coming up now, I think, with the much deeper questions with Dr. Joseph Boots. And also we'll be looking at those political questions in the UK and people's willingness and ability to be endlessly ripped off by their politicians and just keep taking the punishment without ever really looking for a way to make proper change. So anyway, as we said before, at the end of every show, don't stay safe, stay free, because without your freedom, you do not have your safety in a totalitarian regime. And if you enjoy the work we do, please think about spending a few minutes to sign up on Patreon. Thanks. Speak to you soon. Bye.